everyone, and welcome to Action Against Hunger's virtual discussion on the power of women in the fight against hunger. My name is Cara Seymour. I serve as a member of Action Against Hunger's Advisory Council, and I want to thank you for joining us for an important discussion on gender equity in the humanitarian space. With us today are two of my colleagues from the field, Ritah Kabanyoro and Dimple Save. Ritah is Action Against Hunger's country director for Uganda, where she oversees our efforts to implement life-saving nutritional support and food and water security efforts within the country. Ritah has been with Action Against Hunger for over 2 years, previously serving as senior finance officer with World Vision Uganda. Dimple, meanwhile, has been working with Action Against Hunger's South Sudan office as head of nutrition and health department since 2017. She oversees all nutrition and health programming throughout the country and provides technical support to the emergency response team. She is a nutritionist with 22 years of experience working in public health and nutrition at organizations including UNICEF and the World Bank. Dimple and Ritah, thank you so much for joining us today.
You're welcome.
So before we begin, I just want to remind everyone listening, if they have any questions during today's chat, we encourage our audience members to submit their questions using the chat box, and we will do our best to answer any questions at the end of the discussion. We'd like to begin our conversation with some background and context into how hunger and gender are so intertwined. Unfortunately, the top drivers of hunger, conflict, climate change, and inequality disproportionately hit women the hardest. The gap between the number of hungry women and hungry men in the world has more than doubled in the last 3 years, with food insecure women outnumbering men by about 150 million. Yet we at Action Against Hunger are keenly aware on the importance in investing and empowering women in the communities we serve, as gender equality is fundamental to our mission. We would like to start today's discussion with a brief video highlighting some of Action Against Hunger's work in the field, in partnership with someone named Hawa, a mother in Mali who volunteered to become a healthcare worker within her community and received training to help preventable diseases like malnutrition and cholera.
Everywhere we look, women are on the front lines changing their communities for the better. From the halls of government around the world to the halls of their local schools. From boardrooms to city councils. Everywhere we look, women are tackling the world's toughest challenges. From healthcare to hunger, we're working tirelessly to make an impact. The need is acute, especially with malnutrition. Globally, 2 million children still die every year from hunger. That's more than 5,000 every day. Why? Many children with severe hunger don't have access to life-saving treatment. Many parents don't recognize the symptoms in time. Life-saving health centers are often too far away. Meet Hawa. She's a changemaker dedicated to the fight against hunger. Hawa looked around her community and saw mothers walking for hours each week to save their malnourished children and thought, it doesn't have to be this way. She heard about a program run by Action Against Hunger to empower women to become community health workers right in their own villages. She received training to provide care to her neighbors and their children and to treat preventable diseases like malaria, pneumonia, and malnutrition. She set up a small clinic next to her home, does house calls, and teaches families how to prevent diseases through vaccines and hand washing. If a child is malnourished, she can treat them with a life-saving therapeutic food. Hawa can't can't replace hospitals, but we also can't replace the Hawa effect. By going from mother to mother, Hawa is bringing life-saving care closer to children who need it most. Now imagine this all multiplied. There are thousands of Hawas working in communities around the globe, helping an entire generation grow up strong. Another generation of changemakers. Help Action Against Hunger empower more Hawas to tackle malnutrition. One person like Hawa can change her community. Together, we can change the world. Speak up. Donate now. The world needs a better way to deal with hunger. Together, we're creating it. For everyone, for good. Join us. Take action against hunger.
This video captures the importance of empowering women in the fight against hunger. Hawa's motivation and spirit to help her village led her to educating and helping her fellow mothers. And with each conversation Hawa has, a new mother gains the knowledge and insight into how to keep her children healthy and at low risk for malnutrition. I think this is a great segue into our first question of today's discussion. Ritah, I'd love to ask you to clarify on some of the points at the beginning of the video. How does iniquity contribute to global hunger?
Thank you very much. Thank you for the opportunity to speak about an issue that is so dear to my heart. Now, I believe hunger, food insecurity, and nutrition insecurity is a power issue. It is a political, economic, environmental, but most importantly, it is a justice issue because inequalities are both a cause and an outcome of unjust food access, production, and consumption. We live in a world where we are producing more than enough food for everyone to eat. A world where, according to FAO, 400 billion worth of food is wasted every year. A world where overnutrition levels are on the rise, obesity is becoming an issue, and yet it is the same world where over 800 million people are going to bed hungry every night. So clearly our issue is not food, our issue is injustice, our issue is unequal access. So we cannot discuss addressing the root causes of global hunger without addressing the gender or inequalities that exist in our society. We have countries like Uganda, for example, where 72% of our land is arable, 18% of our land mass is covered by water, 3/4 of our population depends on agriculture. We are producing more food than we can consume. And yet 30% of the children under 5 in Uganda stunted. And the reason for that is because the people that are charged with the nutritional needs at household level, our social norms, our institutional structures are not aiding proper access or giving them power to make decisions that they need to address the hunger issues right from the household level up to the macro level. Thank you very much.
Thank you, Ritah. So if I heard you correctly, it's the systemic barriers and traditional norms in place that prevent women from even accessing food. And that continued inequality is driving up hunger rates. Is that right?
Yes.
Thank you. Dimple, why are women disproportionately more likely than men to suffer from hunger and food insecurity?
Thank you, Cara, and thank you for this opportunity where I'm able to share some experiences from South Sudan. The major reason why women are more likely to be suffering from hunger and food insecurity than men is cultural practices which are against women, the biological vulnerabilities of women, social and gender norms which favor men and boys more than girls and women, armed conflicts in case of South Sudan, and then the economic challenges. Women's access and their ability to decide on the resources has direct impact on their ability to achieve good nutrition for themselves and their family. Female-headed households in particular are at greater risk because they do not have access to most of the resources like land, information, finance, training, etc., which is very essential for them to meet their nutrition needs. Besides these, heavy workload and domestic responsibilities also make them vulnerable to malnutrition. Country like South Sudan, where we have multiple crises every year, women face greater challenge to make sure that their family gets food to eat, despite the inadequacy of resources. These crises also lead to domestic and economic crises, which include domestic violence and other harmful practices, like early and forced marriages. According to IOM report for 2018, payment of cows for brides has also contributed greatly to marginalized women and has perpetuated gender inequality and violence against women. Thus, all these issues at one point now lead to malnutrition among women and affect their health and nutrition status. Thank you.
Wow. It's very, very sad to think that such traditional gender norms still exist in communities. When we combine these challenges with drivers of hunger, such as climate change, it's quite clear to see that women face the burden most often. Dimple, to follow up, how can women be our powerful allies in the fight against hunger?
So, according to the report from FAO 2020, South Sudan has one of the highest rates of hunger and malnutrition, with nearly 50% of the population facing food insecurity. In such a challenging context, women can actually be powerful allies to fight against hunger and malnutrition. According to WFP report, more than 60% of the small-scale farmers in South Sudan are women. So, by providing resources like seeds, tools, training, etc. to these women, they can have access to nutrient-rich foods, not only for themselves, but for their families. We also know that women are the primary caregivers in their family, and hence they play a crucial role in ensuring that their families have adequate food and nutrition. At Action Against Hunger in South Sudan, we are actually targeting women through different community structures that are available on ground, like the mother-to-mother support groups. We target them for kitchen gardening and then cooking demonstration, how to prepare recipes with available food materials, which are more nutritious. We also train them on different cooking methods. Cash transfer programs are also available, and they target more vulnerable women, especially the female-headed households. We are also engaging into the VSLA, which is the village level savings and loan groups, and then the income generation activity approach. So we try to strengthen those activities. We also try to train women on nutrition and gender and create awareness, not only women, but also in the community, so that even men at some point are involved and made aware about the situation. We try to ensure that our programs are made safe through training staff on GPV and PSEA, creating or establishing safe space for women and girls. Currently, we are also undertaking a research study in collaboration with UNICEF, which is on GPV risk mitigation or gender-based violence risk mitigation in nutrition program. And the whole idea of this research is to make our program safe and more accessible for women and children. Thank you.
That's amazing to hear. It sounds like incredible work and so comprehensive. Ritah, something that Action Against Hunger is employing is called the Gender Transformative Approach. Can you elaborate on what that means?
So the Gender Transformative Approach is an approach that seeks to challenge and transform gender inequalities that are rooted in social and institutional structures. This approach basically focuses on ensuring that all people have equal power and they have equal access to opportunities and the support they need to improve their lives regardless of their gender. So as Action Against Hunger, we are being very deliberate in ensuring a gender inclusive approach in all our programs. For example, when we are designing programs and projects, we are very deliberate on ensuring that women are included, women are equipped, women are given equal access and equal opportunities to productive assets. For example, they're equipped with knowledge and training. We are setting indicators that are gender specific to ensure that we are tracking our commitment to a gender inclusive and a gender transformed society. But additionally, we are also including men, because as women, we finally understood the rights. At least most of us have understood the rights. We've understood the power that we hold in this world. We hold the entire world, basically. However, our counterparts, the men, still hold us in a certain level. They're still holding us up to the social norms and injustices that are existing. So we are also working to make men understand the rights of women and also become allies and advocates for a gender transformed society for the sake of the women that are supporting the household and also the communities we're living in. Thank you very much.
That's so incredible. I mean, so the gender transformative approach not only addresses the root causes of these inequalities, but is embedded in Action Against Hunger services to empower women to take a more active role in livelihood as well as income generation, and even educates men, on the caregiving role and in looking after kids, and let's involve them. That's great. So I have a final question. How does Action Against Hunger empower women in the fight against hunger?
As I mentioned earlier, we are very deliberate on gender inclusiveness, number one. Case in point for Uganda, we are the largest refugee hosting country in Africa and the fourth in the world. But over 60% of these refugee households are female-led households. So we cannot discuss transforming their lives if we are not discussing gender inequalities and inequities. So we are taking a very gender-based approach in our food security and livelihoods and nutrition programs. We have female-led farmers groups, and in all our farmers groups, we ensure that at least 80% of them are women. These women are these women are supported to access productive assets, including land, including training, including skills, including agricultural inputs, for them to be able to make decisions for their households and income, transform their lives, and also transform the lives of their households. We believe that if we can address it at this very bottom level, at the root causes, then we are slowly transforming all the gender norms and in turn addressing the nutritional status of our country, Uganda. Additionally, as I mentioned earlier, we are very deliberate on including men. Case in point is under care group model in Uganda. In addition to having female care groups, we also have male care groups. And the whole point of having these male care groups is to make sure they understand their responsibilities. They understand that caregiving is not just for the women, that they, the men, also have a responsibilities as fathers and as heads of households. So in all of this, we are making sure that we unburden one gender and then make sure the other gender also understands what their contribution should be and what it can be, and ensure that women rise up and they're able to make decisions that concern their households, that concern their communities, and also make choices for the betterment of their own lives. Thank you.
Wow, really, equality is a people issue. It's not just for women, it's for men, it's for the world. It's going to make the world a better place. It's wonderful to hear. I'm always encouraged when I hear about all the incredible ways Action Against Hunger is implementing support with gender equality right front and center there. I also truly appreciate Action Against Hunger support services that help women access land to farm, as well as financial credit to establish business and generate income. It's really inspiring, all this. It really is.
And also advocating, working with the governance structures, the governments, the social structures, the traditional structures, to ensure they also help us in advocating for the rights of women and transform laws and policies.
Wow, it's so impressive. It's so impressive. Well, sadly, I think that wraps up the discussion portion of today's chat. I want to thank you so much, Dimple and Ritah, for sitting down and providing us such insight and clarity and, to be honest, inspiration. It's encouraging to hear how fundamental gender equity is in Action Against Hunger's work.
Thank you as well.
Thank you, guys. At this point, I think we'd like to open up the floor to audience members to see if they have any questions. As I mentioned at the beginning of our discussion, there's a Q&A feature you can use via the chat box, so please feel free to submit your questions at this time. So I'm just gonna... Okay, here's the first question. We've discussed the role of women in the fight against hunger, but an audience member is curious what role men play in this effort. How does Action Against Hunger work with men to improve gender equality and change norms? We've touched on that, but let's touch on it some more because it's really interesting. Anyone?
Yeah, maybe I can. Just as Ritah mentioned for Uganda, in South Sudan as well, we work with the government, with the ministries, the Ministry of Health, the Ministry of Gender, Child and Social Welfare, and we make sure that when we are working at community level, we engage with community, not only with women, but also with men. Because like she mentioned, it is very important to make sure that the men are also aware about what are the rights of women and what are the best practices to be followed at family level or at household level. I can share certain examples. Like I said, we have mother-to-mother support groups. We also have the father support groups, which have actually been created by the men themselves when they saw the women support groups, mother support groups coming up and working towards the improvement of nutrition and health status of their families. The men also have started seeing the benefits, and they've come up. Like there is an example where one of the husband of the team leader of the mother support group helped her in kitchen garden. Not only helped her, but he set up his own separate group of men, and he convinced them. And it's a bit easier to get that kind of land at village level where they can combine and make some efforts. They've come up with onions, and they have set up huge onion farms. So there was a time where we have to export onions, but now with the kind of onions they are producing, I don't think we need to export. They are selling that onions, they are using it for their own family, they are getting additional income, and that additional income they are using for other activities as well. There's another example where usually it is seen that when it comes to a malnourished child, it is a cultural belief that it is the responsibility of the mother or the woman to make sure that the child has been treated. Somehow she is held responsible for that. However, we have examples where men have supported their wives. They have come and enrolled their children in our nutrition sites, and they have followed up every week as per the treatment protocol till the child has recovered. So this also gave us idea that because majority of the caregivers are women, but now that men have really started coming up with these kind of actions, we have started establishing separate waiting bays for men as well, so that they are comfortable in the waiting bay while they are waiting for their turn to be provided the service, and women are also comfortable in their waiting bays. So also they feel a belongingness. They don't have to just go and wait outside because women are sitting inside. So just to also make them feel comfortable and to make them part of the whole action. So these are the few things that we are trying at Action Against Hunger level in South Sudan. We are also, we have just initiated a pilot on the care group model. It's a little different from Uganda, where we are now using the community structures of mother support groups and father support groups and upgrading them as care groups. And then also including the component of household dialogue where both men and women have equal opportunities for discussions, because we are also using SBCC or social and behavior change component to see how we can improve their behaviors and make sure that women are equally part of all the decision-making processes at home. Thank you.
Thank you. Incredible. Absolutely amazing. Another question. A member of the audience would like to know about what our government partnerships look like in each country. Generally speaking, how does Action Against Hunger work with governments to implement services? Good question. Right.
So for Uganda in particular, as I mentioned earlier, we are advocating for changes in laws, changes in society norms and beliefs. And for some of these, you cannot do them without using the government structures. For example, when we talk about land rights, access to land rights, when we talk about inheritance laws, you cannot change that norm without working with government or from that level of institutional influence to bring it down to the household. Additionally, most of the governments that we work in, Uganda case in point, they finally recognize the role of women. They finally recognize the gender gap that is existent and the inequalities that need to be addressed. And they have come up with some laws to address the gaps and the inequalities. However, as you know, you may know that most of these policies are not accompanied by adequate investments in financial, technical, and other resources that are needed to make sure they are implemented. So we have very good laws that have been signed. However, they are not being implemented due to limitation of resources. So as non-state actors, like Action Against Hunger, we go in to support and complement the government to ensure some of these laws are, number one, people understand them. We make sure that people know the laws are in place. Secondly, we complement the government efforts to make sure they are implemented. That's one way we are working with the government of Uganda. Thank you.
Thank you. The question is for either of you. What do you see as the biggest challenge Action Against Hunger faces in the continued fight to empower more women in the field? Is gender equity achievable?
I believe gender equity is very achievable. Actually, we should not be discussing gender issues at this point in time. With the level of technological advancement, the development we are seeing in the world, I mean, we're seeing electric cars, people going to the moon and Mars. We should not be dealing with gender issues at this point in time. So it is very achievable. However, the challenges that I see, as I mentioned earlier, is limited investment in this issue that is glaring in our faces. And also the coordination mechanisms are not very strong. For example, if the whole world came up and said, we are fighting these gender inequalities, we are fighting these gaps, I don't think it will be an issue in the near future. It's something that can be addressed. Secondly, the other challenge that we face is limitation of data and research regarding these inequalities and the vulnerabilities that exist. That not a lot has been invested to find out, to go to the root cause or the depth of the matter of these gender gaps and how they can be addressed. So when you try to find information, especially for some communities, some countries, some statistics, some of this is not readily available. So we have to be very intentional, very deliberate, work with everyone. It has to be a collective effort for all of us to be able to achieve the closure of this gender gap. It is very possible. It is achievable. If we are talking about a world with zero hunger, we cannot do that without addressing the gender gap. Thank you.
Thank you. This is incredible. I mean, I find this so inspiring, but also very, it's sad as well. So, but I think that's all the questions we have time for today. Dimple and Ritah, I just want to thank you again for your brilliance, insight, clarity, devotion, everything amazing. And into this really important topic of gender equity in the humanitarian space. I also want to thank everyone for joining today's discussion. We apologize if we were unable to answer your questions from the chat, but we encourage you to check out Action Against Hunger's website to find out more information on our programs and interventions designed to empower women and fight against hunger. You can visit actionagainsthunger.org or check out our social media pages on Facebook, Twitter, and LinkedIn. Thank you, Ritah and Dimple, again. Thank you again, and have a lovely remainder of your day.